Okay, hi everyone, and welcome to this webinar as a career in research for me. We're looking forward to talking about public health research with you today. My name is GJ Melendez-Torres. I'm professor of clinical and social epidemiology at the University of Exeter. I'm also associate dean of the NIHR Academy for Researcher Inclusion, and I'll be hosting this webinar today. So we're looking forward to a really exciting lineup of keynote speakers, but just for now, some housekeeping. We've muted your mics and turned off videos, but you are welcome to communicate with us via chat and Q&A features. But we're going to ask that you put any questions you have for the Q&A in the Q&A box. You can also turn on the live transcript by clicking the live transcript button and then selecting show subtitle. And you can also contact us with general queries by using the chat button. Okay, next slide, please. So today's program, I'm going to introduce a little bit about research careers in public health, and I'm going to hand it over to my colleague, Nicola Sheen, who will talk a little bit about the Research Support Service Specialist Center for Public Health. And then we'll hand it over to our four really excellent keynote speakers, all of whom are at different stages in their research careers in public health, to talk a little bit about their experience and their learning as well. Next slide. So, first things first, public health research careers. Okay, so this section is just going to introduce a little bit around how we understand public health research within the National Institute for Health and Care Research, as well as some of the roles that you might have in terms of public health research as well. So in NIHR, we understand public health research as including a few things. One of those things might be understanding how factors in your life, your community, and your environment impact your later health, and what we can do about those factors. So really epidemiology and social science to help us understand problems, and then developing strategies to do things about them. Another key example of public health research is developing and evaluating new programs to improve the health of populations, as well as understanding and evaluating how policies or other changes to the environment impact the health of populations. So focusing on the health of populations, understanding what makes them better, what makes them worse in terms of their health, and also understanding what we can do about those things and how well the different things we might do work in terms of impacting the health of populations. Next slide. Now, in terms of a research career in public health, really public health research requires everyone. And so there's a range of roles that you can take. There's a range of methodologist roles as well, who are the people who are the experts in the methods that we need to use to develop really good research. Those include statisticians, epidemiologists, trial managers, data managers, impact specialists, sociologists and qualitative researchers, and operational researchers. So really anything to do with health research has an important methodological role in terms of public health research. It's also an important role for research delivery support, which again draws on a broad range of professions. Research nurses, allied health professionals, pharmacists, scientists, clinical research practitioners, physician associates, and social care practitioners. There's also a range of hybrid roles. You can have service and delivery hybrid roles, for example, colleagues of mine who work as clinical public health nurses, and delivery and research leadership as well. So really any role in health, any role in medicine, any role in social care, and any research role really is important to get underneath and to really develop the future of public health research. So many different routes into public health research. Next slide, please. Now, I just want to take a moment to introduce what NIHR is specifically, just so that we're all on the same page around what the National Institute for Health and Care Research can do for you. Next slide. So NIHR is the health and social care research arm of the nation, and its key mission is to drive life-changing research for the health and wealth of our society. Next slide. So NIHR funds, enables, and delivers world-leading health and social care research. And one of the things I would really stress about this is that even though an important part of its work is public health research, it's really much broader than that as well. So a range of opportunities to understand the different kinds of research and the different kinds of impacts that we can have through that research for the health and well-being of the nation. Importantly, NIHR's reach is very broad. So it funds or part funds over 10,000 frontline research delivery staff. It funds researchers to hold career development awards, which help you get a foothold in and develop your research. It also funds research projects themselves, more than 1,000 active health and social care research projects at any one time. So really, if you're hoping to develop a career in public health research, NIHR is the place to start because it has many, many opportunities to develop your career, to launch your research career, and to build and develop it as you go. Next slide. So NIHR supports research in public health in many ways. One of the ways it does that is by funding research into public health. One of the ways that it funds research is via the Public Health Research Program, which funds projects and large-scale evaluations of public health interventions. And that research program is run by NIHR as well. NIHR also supports research in public health through offering training and career development for researchers and practitioners, and that's through the NIHR Academy. Importantly, these schemes start everywhere from right at the undergraduate level all the way through to very advanced senior academics as well. And we'll hear about a range of experiences with those training and career development opportunities later on in this webinar. NIHR also supports research in public health by delivering a network of support and expertise to enable the development of research across the public health sector. So really working at a system level to ensure that public health research has the support it needs to really make the impact that we know it can have to improve the health and well-being of the nation. Next slide. One of the other aspects of NIHR's research portfolio that is really important to stress is a focus on research inclusion. And research inclusion is important because it means that the public health evidence we generate, the public health research that we do, benefits everyone nationally. Research inclusion is now a condition of funding in NIHR. So if you're hoping to seek NIHR support for your public health research, one of the requirements will be for you to demonstrate the ways in which you've thought very carefully around how everyone who might benefit from your research can also participate in your research. NIHR's research inclusion strategy includes several prongs. One of those is to become a more inclusive funder of research. So to fund different kinds of people and different kinds of researchers to do research that will really make a difference for the health of the nation. To widen access and participation for greater diversity and inclusion, which really ensures that, again, everyone who stands to benefit from research can participate in research as well. To improve and invest in the NIHR talent pipeline, so people who are coming through and developing their research careers have all the opportunities available to them to improve their research careers. And also to embed evidence-led diversity and inclusion approaches and to collaborate with partners for impact and sustainability. So both of those together, and in fact the entire research inclusion strategy, suggests that the NIHR is really doing its best to ensure that the research it generates makes an impact for everyone in the nation, but also everyone who has something to contribute to the research that will improve the health of the nation has the chance to join in. Next slide. Now, there are a range of current awards and programs, and these current awards and programs are part of the NIHR Academy. And as a reminder, the NIHR Academy is the part of NIHR that really funds and invests in the research careers of people who are hoping to get footholds in applied health and care research, which includes public health research. These schemes go everywhere from initial experience all the way through to senior academics who are at or near professorial level. And this is important because it suggests, and in fact it indicates, that NIHR funding isn't just for established researchers. It's also for people like many of you on this webinar who are really hoping to get their first foothold in to a public health research career. We put a box around initial experience because this is likely to be very relevant to many of you. And that initial experience in research box includes internships, undergraduate internships, as well as internships for health and care professionals, as well as the Insight program. And the Insight program funds nurses, midwives, and allied health professionals to develop their research careers through undertaking postgraduate study, including in public health research. If you're ready to start moving on your public health career, you can also explore the various pre-PhD opportunities. The flagship one of those is what's called a pre-doctoral award. And a pre-doctoral award gives you up to 2 years of time to undertake postgraduate study that will help launch your public health research career, but also to get some research experience to help you sharpen and focus your interests. This award is highly flexible. So if you have a master's degree already, you can really use it to do some top-up training and to get some additional research experience. But the pre-doctoral award is a really exciting on-ramp to further NIHR study and is really good for people who are early in their careers and hoping to take that on-ramp to maximize their public health research careers, including when that involves working as practitioners as well. Finally, or rather not finally, but after a predoctoral award, you can also take up a doctoral award. And a doctoral award funds a PhD training so that you can undertake a funded PhD, including salary and training costs. PhD awards or doctoral awards are valuable for people who are really ready to take that step to undertaking the higher degree by research that they would need to take in order to launch their independent careers as researchers. And doctoral awards, again, are salaried, cover training costs and tuition, but also help you to access the broader NIHR network of resources, which are many and are really valuable. Beyond PhD, you can apply for a postdoctoral award, and that's a multi-year fellowship that will let you begin your independent research career after a PhD. And then finally, at the most senior level, you can apply for a research professorship, which is for people who are rapidly becoming world leaders in their field, or for a senior investigator award, which is for people who have long records of service to NIHR in particular. So what I hope you take away from this slide is that there's an opportunity for everyone, people who are just starting out and people who are much further along. And there's a real sense of a pipeline and multiple points at which you can get on the ramp to really develop and accelerate your career as a public health researcher. Next slide. The Research Support Service is also here to help with that. And I'm going to hand over to my colleague, Nicola Sheen, in just a minute or two to talk a little bit more about this. But the Research Support Service, including the Research Support Service Specialist Center for Public Health, is an exciting opportunity to get access to that central expertise. Perhaps you might be working at a university that doesn't have a very strong tradition of getting NIHR funding in, or perhaps you would like some outside perspective. The RSS Special Center for Public Health in particular is a free and open service that will help you to really get underneath what you need to know to submit a successful application to NIHR. It's available to you if you're based in England, so we really hope that you take up this resource because it's an exceptional opportunity to get some expertise, particularly when you don't have that expertise local to you as well. Next slide. And the Pre-Application Support Fund is also important to mention. So the Pre-Application Support Fund gives people a chance to buy some time and a little bit of resource to develop some very focused training and to have the headspace they need to enhance their chances of making a successful application to an NIHR career development scheme in the future. And that career development scheme can be pre-doctoral, doctoral, or postdoctoral. What's important about the Pre-Application Support Fund is that it's highly flexible. And its real goal is to open up opportunities for people who might be working in clinical practice, who might be working in local authorities or in social care, or who might be working in universities that don't have a long track record of being successful in NIHR funding. And it creates a bit of space and time for them to do the training they need, to have the space and time that they need to really get underneath what they need to do to submit that successful application. So we're really proud of the Pre-Application Support Fund, and we'd encourage you to take up this opportunity if it's available to you. Next slide, please. Great. So thanks very much for your time. I'm now going to hand it over to my colleague, Nicola Sheen, who will talk a little bit more in depth about what the Special Center for Public Health can provide to you as someone who's hoping to seek NIHR funding for public health research. Nicola, over to you.
Thank you, GJ. Good afternoon, everybody. Please bear with me. I'm hoping that the voice lasts for the 5 minutes I've got to give you a whistle-stop tour of the Specialist Centre and some of the things that we can offer in terms of support. So as GJ said, I'm from the Specialist Centre for Public Health Research. I'm based at Newcastle University, but we are a national centre. And if I can have the next slide, please, I'll give you a little bit of background as to who we are. So we're delivered by Newcastle University and partners, and the aim of the centre is to support the use of public health research outside of NHS settings to help inform policy and practice. We've got 3 satellites across the country, and across our centre, we've worked really hard to develop resources and provide opportunities for funding that help promote the development of research skills and support applications for some of those career development awards that GJ has just mentioned. We don't exclusively work just with public health professionals. Our offer is curated so that we can also work with other settings that are also working to tackle the wider determinants of health and health inequalities. So that can be other local authority type roles and sectors such as the VCSE and education. For some of you who are looking at maybe taking up your first position in public health or first type role in public health, then you'll find that there's a lot of collaboration going on with areas such as housing, education, things tackling poverty. So lots of collaboration across the sector. Next slide, please. So some of the areas of support that we can offer is that been putting a lot of funding into local authorities, and we've created networks of funded positions, which include our LARP network, which is local authority research practitioners. If any of you are in public health departments at the moment, it could be that your local authority has one of these posts. We've funded over 90 across the country so far. We also have senior professionals, which could be public health or policy professionals who've taken up roles called FELs, public health engagement leads, and they connect a geographical patch and encourage their sister and neighbourhood local authorities to get involved in research and to collaborate on research activity. Our research design advice service is a team of methodologists that are based across all of those centres that I mentioned that have a really broad range of skills. They can be specialist design advice skills such as health economics, data science, and it could be that if you're further on in your research practice, you need very bespoke support and guidance like that. Or it could be that actually you're in a very early stage of your research scoping and you're just wanting some early stage advice. We're really open to talking to anybody at whatever stage of practice and your stage of funding and seeking support to achieve funding. So please do get in touch with us, and I've got contact details for the centre further on in my slides. The team will also give bespoke support for those of you who want to look at those career development awards. And I've got a slide dedicated to what I'll talk around for that a little bit later on. And our training and development offer, again, that recognises that people are at different stages of their research journey. So there's a huge amount of resource that we've got available, whether that's people who are just looking to dip a toe in research, whether it's colleagues across different networks. We're linking them with public health intelligence. So really trying to support across the full network and give the widest cross-section of people the maximum benefit. We've got research governance and ethics scoping going on at the moment. Again, local authorities are sometimes newer to research and maybe don't have governance frameworks that already exist. So we're looking at helping establish those and finding out what works in different settings. And briefly, just to touch on the research delivery pilot, we've been awarded funding to scope that over the next couple of years. And essentially that's scoping the needs of researchers, again, outside of NHS settings, looking to see what a new delivery support service might look like. Next slide, please. So GJ's mentioned the detail of these fellowship career development awards, so I'm not going to recap over that, but what I will say is that the support that you can access through the Specialist Centre, which is one of the links that's on the slide, I really do encourage anybody who's looking at one of these fellowships to get in touch with us. Our support will be tailored to your needs, and that can include assistance to identify appropriate supervisors and mentors. It could be advice from previous applicants. It can be holding mock interviews. It can be helping you write your submission. So I really do encourage people to get in touch with us via that contact form. Full details of all of the eligibility criteria and times of opening and that kind of thing are available on the link that I've also embedded, the research career funding programs. Please do have a read through that and then contact us if there is a way that we can help you shape your application. Next slide, please. Moving on to our grassroots award, we recognise that not everybody is at a stage of their career where they want to apply for a very academic award. So we have created some pots of funding of up to £5,000 for short-term part-time study or training that can be a first step into public health research. So it could be that you're a practitioner and you're wondering, how do I segue into a more research-based role? this is a really exciting opportunity. We've had one award that's funded over 20 applications so far, and we've got another call coming out, which is available, closing on the 9th of June. I've put the link on the slide there so you can access the full information around that. But again, that's typically for people that have not had any formal research experience yet, and I wanted to take their first steps on their research journey. Next slide, please. So to start to sum things up, I've included a photograph of one of our LARP network events, and I hope that this demonstrates the diversity of the offer that we have at the Specialist Centre. We have purposefully curated and created resources that are accessible, that are shareable. We want to encourage as many people as possible to get involved in public health research. So whether it's your first role or whether you're more established and you're looking at one of our academic awards, we'd love to hear from you. We'd love you to get in touch and see how we can help you at the Specialist Centre. Next slide, please. So details of all of our resources are included here on these embedded links. We are on LinkedIn. We've got a mailing list. We have a webinar series that goes out very regularly. So please do link in with us on any of those formats and join in on any of our webinars or take advantage of the resources that are available to you. So thank you very much.
Thank you very much, Nicola. Okay. So we're now really fortunate to be joined by 4 people who are at different stages of their public health research careers, but who all have a lot of experience of having their research being supported by the NIHR. So we're going to hear from Kat Jackson, Claire Tatton, Russ Jago, and Jyot Singh Chandan, and each of them will talk a little bit about their experience with public health research and share some of their lessons learned. So I'm going to hand it over to my colleague Kat and take it away.
Thanks, GJ. Thank you so much for inviting me along today. My name is Kat Jackson. I'm a pre-doc fellow at the University of Liverpool, and I'll talk to you a little bit about my NIHR pre-doctoral fellowship experience. Next slide, please. So just a little bit about my background to illustrate that there's no set journey into research. I originally graduated with an undergraduate degree in geography, and my background is mainly in project management. I've previously worked within a local authority setting, and I've managed research projects within universities. After some years of working in project management, I knew I wanted to get more into research, but I didn't really know how. So I started off by completing a master's in Liverpool in public health. This then led on to the perfect opportunity that came up when I successfully applied for the NIHR pre-doctoral fellowship, which has been a completely different experience for me, with the main goal to gain more research experience. I started in March 2024 and I've been immersed in research ever since. Next slide, please. So my fellowship experience, I'd say, has been very vast and varied. I'd say, honestly, it's been the best development opportunity in my career so far. I said in my interview that I wanted to make a change within communities, and I've really tried to embrace that. I've been out into communities, I've built trusted new collaborations with public members, community groups, charities, local authorities, and other universities. The pictures here show some of my highlights, talking at the annual scientific meeting, which was nerve-wracking but an amazing experience, supervising a summit intern and then taking them down to London to forge their own new collaborations, presenting a poster at an international conference in Rich in Liverpool in front of Marmot and Dame Margaret Whitehead. And I've also run my own workshops in research to bring people together to talk about my area of research, which is food insecurity, to hear other different perspectives. And that was probably one of my proudest moments because the workshop that I held a few months ago attracted 7 different local authorities, as well as representation from Save the Children and Trussell Trust. And I also produced a blog about this on the SPHR website. Another highlight was last week. I actually launched an exhibition at the Open Eye Gallery in Liverpool, which was part of creative dissemination for my research funding that I'd secured through SPHR. The exhibition features photographs of different types of food support throughout Liverpool, and it was developed in collaboration with local photographer, the community, and the public advisors involved in that. Next slide, please. So just more specific highlights from my predoctoral fellowship. I'd say I've been well supported and I've had a lot of opportunities to carry out training that's been specific to me, and that's been in qualitative and quantitative research skills that I've identified as part of my development. Public speaking, there's a picture there of me presenting at the annual scientific meeting, and this is something that I used to dread, but I have grown in confidence, and you only do that by presenting at conferences, webinars, and last week I was an invited speaker at another university to talk to undergraduates about creative dissemination. I've also had the chance to work and be involved in a lot of other different research projects that interested me and my research interests. So I carried out a mapping exercise with the Food, Pregnancy and Me project. I've also worked on the Mandela project, which was working with Birmingham City Council, evaluating their emergency food aid response. And as part of your predoctoral fellowship, you get to carry out a research placement, which I did mine with Knowsley Council, reviewing their food insecurity interventions. I also had the opportunity to apply for internal funding, so that I got more experience of managing my own research. And through that, I was able to explore how local authorities are using the Household Support Fund to support families. And that's where the creative dissemination has come from with the photography exhibition. And I've also got planned publications from this to come up. Next slide, please. So next steps for me, I'd say I've really enjoyed the fellowship, so much so that I want to continue on this journey within research. I would now class myself as a qualitative researcher, which I probably wouldn't have before. I hope to develop a PhD application, which will possibly be an NIHR doctoral application, or there's also the option for me to do PhD by publication, but it's nice to have options. I plan over the next few months to produce some publications from the research outputs that have come from my projects, and I want to look more into the creative research dissemination side of things, so probably an overarching exhibition of the images produced from my award. Next slide, please. So recommendations for anyone who wants to become involved in NIHR research, and my advice would be 3 things. So firstly, experience. Put yourself out there as much as possible to gain experience where you can. Reach out to people. My first role in research was from emailing an academic who was working in a research area I was interested in. So experience can come in many forms. You can take part in meetings, conferences, and get involved in community events that interest you as well. Number 2, networking and collaboration. Don't underestimate the power of networking. The best opportunities I've found sometimes just come from fleeting interactions. That can be from people you meet with at events, people you speak to, in community settings, and within academia, that could be the next person you speak to, could be a supervisor or a project collaborator. And I'd say thirdly, be brave. I'm definitely guilty of imposter syndrome, but I would say try and put yourself forward for things. Confidence is built by learning new skills and undertaking new experiences. Next slide, please. And finally, I went back and had a little look at my original successful fellowship application that I'd submitted 2 years ago to find out what I'd hoped to achieve from the process. And I'd written, I feel that the fellowship would enable me to complete valuable training that would prepare me for a future career and give me a grounding exposure to enable me to complete a PhD in public health. And I'm pleased to say that the predoctoral fellowship has delivered on that. Thanks so much for listening, and feel free to contact me on my email there. Thank you.
Hey, good afternoon, everyone. Lovely to be here. So, my name's Claire Tatton. I'm a public health specialist based at Torbay Council in the southwest of England. And I'm also an NIHR doctoral fellow based at the University of Exeter. I'm just going to share with you a few bits this afternoon around my path into research, some of the highlights and benefits of an NIHR Career Development Award, and recommendations for anybody who is thinking about taking their first steps into research. If I can have the next slide, please. So my introduction to research very much came off the back of my Master of Public Health degree. I'm working as a public health practitioner in a local authority. Prior to this, my education and work background was very much focused on things like business management, operations management, and commissioning. So really quite far away from research. So when I came to public health, I had very little, if any, understanding or experience with research whatsoever. Found myself very, very quickly kind of catapulted into a position where I was having to engage with research very regularly, provided with the tools and skills and building of confidence to actually be able to engage with that research and appraise it, but also how to use that research to inform what we do in practice. What I sort of found through this process was sort of, I guess, an inspiration of what research can be and can do, but also some of the challenges of working in practice where there are gaps in research. And so my interest was really sort of born out of this place of how we might sort of create greater synergies between the priorities and goals and even the language spoken between researchers and practitioners. This led me to apply for an NIHR pre-doctoral fellowship. And I really used that to sort of begin to make that pivot, if you like, away from just being a user of research to begin conducting research myself. And this, most of my experience was in evidence synthesis methods, and used it to sort of really get to grips with my research area of interest and begin to map my way to a doctoral fellowship application, looking at smoking and pregnancy, which is what my research is focused on. While I was in that application phase, I was fortunate enough to secure a part-time research secondment position at the University of Exeter in an NIHR-funded research team there, building again on that evidence synthesis kind of focus, and indeed also had the opportunity to progress my career in practice at that point into public health specialist. So moving from that kind of project delivery role into strategic development, where I now lead the health behaviour change portfolio. I started my doctoral fellowship 4 months ago, so I'm very much, I would say, in the sort of immediacy of getting that work underway. But what I do know for me in terms of long-term kind of career goal and aspiration in terms of continuing this route in research is I want it to remain very bedded to that original intention and interest for me, which was around that synergy and translation gap between research and practice. And I've been really fortunate that the flexibility of NIHR Career Development Awards is such that I've been able to take up these research positions while also working my role in practice. And that's been a choice that I've made and one that I continue to intend to keep making. If I could have the next slide, please. So thinking specifically to some of the benefits and highlights, the first one might seem quite obvious for a kind of career development award, which is this protected time aspect. The reality is that if you're trying to kind of tag research on as sort of like a hobby, I know that for me that would have been very challenging to do in amongst the kind of busyness of day-to-day working. So having that protected time is such a luxury and a benefit to really be able to get your head down and focus. And it isn't just research as a hobby, it becomes an integral part of how you plan your week and your job, which for me has been a huge benefit. And I definitely am much further ahead in terms of where I would like to be than I would have been without that protected time. Experience in different aspects of planning and conducting research. One of the things that I think is really interesting in moving from that kind of being a user of research evidence into actually conducting it yourself is that you suddenly become confronted with the reality of what it's like to actually deliver a research project. When you're using research evidence, at least for me, all I could really judge it on was a very shiny publication in a nice journal. I thought, well, isn't that incredible? Look at the geniuses behind that. And so the experience of delivering kind of the different aspects of planning and conducting research, so that can look like writing a protocol, writing an ethics application, working through how to analyze your data, what spreadsheet formatting to use to extract your data, gives such a much more well-rounded kind of understanding as to that sort of research journey, how it comes from conception into being. What I found then was sort of an ability to start building a research portfolio. So similar to Kat, being in a fortunate position to actually publish some papers, which has been really important in terms of that beginning kind of career stage with regard to research, because it's enabled and set me up, as I say, for opportunities like my research secondment, but also applying for a doctoral fellowship. It's enabled me to identify from my previous research that I've conducted what I want to go on to next. So to really build some momentum and a bit of an identity around my research portfolio. My favorite one has been the opportunity to learn from and work from other researchers. And this has been great in terms of that sort of getting to grips with how you go about doing research. There's so much that you can learn from training courses, but ultimately, I think a lot of research is you learn by doing. And so surrounding yourself and being kind of in the vicinity of other researchers with different areas of interest who have different levels of experience has been invaluable in terms of making those connections, helping me kind of hone my skills and think differently about the way I look at kind of my research and the way I want to kind of conduct it. And then finally, making links between research and practice. And this has really this has looked very kind of multifaceted for me in a way that I didn't expect when I came into this. So there's sort of the more obvious things of what I anticipated, including how my practice priorities. So I work a lot in tobacco use. So how the priorities playing out on the ground might inform the research questions that I go on to ask and answer. Dissemination opportunities and engagement opportunities. So when I'm looking at planning that research, who can I call on locally, who can help input into that? But also, what are the forums where I might share my research outputs with to ensure that that research does make that impact on the ground? But what I've also found is that as my kind of comprehension of research methods and ways of looking at public health problems has grown, and indeed my confidence with that in terms of what skills and approaches to deploy, it's also changed the way, and I believe improved the way, that I operate in practice. I've definitely seen things like, when I go out to commission, say, an independent piece of evaluation, the way that I look at that and the approach that I take to that is very, very different now than it was back at the beginning. My confidence has grown. So when I see a gap in research, I see it as an opportunity for how might we design something locally, put some theory-based evaluation kind of framework around it and run with that locally. And those are things that a few years ago when I started this, I wouldn't have had the confidence to do. So I can see those kind of synergies, if you like, where my experience and practice has definitely helped me shape my research approach and priorities, but how that confidence and understanding of research has shaped and changed and improved the way that I practice. And that's been a real kind of unexpected but great benefit. If I can have the last slide, please. So in terms of my recommendations, similar to what Kat drew on, I would say don't wait for a perfect amount of taught knowledge to start exploring doing research. I've often said to people that when I came into this, I sort of thought that research was a bit of a dark art, something that was kind of a known thing among very smart people and a select few. I think over time, what I've learned is that you just have to sort of start exploring it and start doing. There is, of course, huge benefit to undertaking formalized training, But fundamentally, you have to start going. You can't learn it all from the sidelines. Secondly, and this is really sort of pointed to kind of other people who might be working in local authority contexts or organizations that don't have a kind of research and development kind of arm to them. Discuss the opportunity, particularly these career development opportunities, off early on with your employer. My local authority has been incredibly supportive, but it doesn't always mean that they've been sort of research ready in the sense of the understanding of what me taking on this fellowship might look like and might incur. Now you have the benefit through the NIHR structure of having a higher education institution that you're kind of assigned to, which will support with everything around ethics and things like that. But there are still things around, well, what does it look like when funding comes through NIHR and we try to make payments to members of the public for their involvement and engagement? Local authority is, at the end of the day, a publicly funded organisation. And so sifting out some of the kind of intricacies around reporting lines can be quite a challenging one. Find future focused supervisors and mentors. When I first started this, I really came into it looking for opportunity to do research. That was as short-sighted as I was. I wasn't thinking about how I might line up methods, research questions to actually create that pipeline of opportunities to pave a way to a doctoral fellowship application. I wasn't thinking about how to begin creating a research portfolio or moving from one to the other. I'm incredibly fortunate and grateful to this day for those kind of future focused supervisors that I had who helped to map that for me while I was just busy focused on, am I actually doing this right? Because I acknowledge that that has saved me a lot of time and really laid out a pipeline of opportunities for me that in and of myself I wouldn't have known how to create. Ask about collaboration opportunities. I've been really fortunate that I've found a sort of home within kind of the local NIHR infrastructure within the University of Exeter. And that really helps with that collaboration, learning from other people, but peer support. One of the challenges, I think, for kind of training and career development awards, particularly when you are working within a kind of non-research or immature research kind of organization, is it can feel quite isolating. So I've been hugely kind of grateful and fortunate to land in a group where I have other people who kind of understand what it's like being an early career researcher. And my last one would just be to think about research impact early and often. This is a huge thing for NIHR and for NIHR funding. And I was very clear when I was coming into this that I wanted my research to impact and improve rates of smoking in pregnancy and kind of positive birth outcomes for mothers and babies. I hadn't necessarily thought so much about what that might look like. That's a very lofty goal and not a bad one to have, but almost impossible to measure. So encourage people to kind of think about what might those steps of impact that are much more tangible and measurable actually look like, because this will be central to NIHR funding. And if you're thinking about that early and often, that will really set you in good stead for articulating what your research priority is and how you will see it kind of come to make real world impact. That's it from me. Thank you very much. I look forward to answering some questions later on, and I will hand over to Russ.
Hi everyone, I'm Russ Jago. I'm a Professor of Physical Activity and Public Health here at the University of Bristol. And I'm going to tell you a little bit about my research journey and how I got to where I am. So next slide, please. So this slide kind of shows a bit of a kind of winding path that I've taken in my career. And I'd like to go all the way back to the beginning. So I actually started as a climbing instructor and a youth sport coach. And I found by doing that, I really liked spending time with children and young people. And I identified lots of gaps in terms of their physical activity and some things that I thought I could do to help. And so I ended up doing an undergraduate degree in sport and exercise science. So not really related to public health at all. And I really enjoyed that. And I continued to kind of coach and work with children and young people during that period. At the end of my undergraduate degree, I didn't really know what I was doing, and I ended up working in an electronics store for a while. But I subsequently was able to get a job as a lab technician at the University of Reading, and I figured out quite quickly that at that time staff could have a waiver for PhD fees. So I managed to secure a waiver, and I did a part-time PhD on children and young people's physical activity. And that was really interesting, and I learned a lot. But towards the end of that, I was starting to think about, well, what's next? Where can I go from here? And I saw an advert in a newspaper for a professor of children's physical activity at a medical school in Houston, Texas. And I contacted the Tom Baranowski, who was advertising for the post, saying, I'm not remotely qualified for this in any way, shape, or form, but do you have any junior roles coming up? And we ended up having kind of email correspondence for quite a long time. And in the end, I ended up securing a postdoc with his team. And I ended up working on a very large cluster randomized controlled trial in 42 middle schools across 7 US states. One of the biggest studies that's ever been done. And in that period, I learned a huge amount. I learned from that team very much the kind of focus on team ethos, and that everybody had to support each other. Everybody was reliant on grant funding. And so there was very much this ethos of sharing research, sharing early drafts of grant applications and papers, and getting everybody to comment on them so that the overall project improved. I also learned quite quickly in the weekly data meetings that my statistical skills were not good enough, and that I was kind of lagging behind. And so I was able, through some of Tom's connections, to get permission to audit a master's degree in biostatistics. So whilst working full-time, I also kind of did a part-time master's degree evenings and weekends. And I just found from that kind of recognizing that gap in my knowledge really helped me to kind of understand the research better. And I think that's kind of one of the things I would just say to people is you kind of need to recognize not just your strengths, but where are you weak, and what are the ways that you might be able to use within your system and the NIHR support structures to kind of plug those gaps. So after working in Texas for a while, I got homesick and moved back to Bristol in 2005. And then in 2009, I was very fortunate to have a NIHR Career Development Fellowship, which is absolutely critical in the development of my career. It enabled me, I think, 3 years to really focus on research, enabled me to kind of push ideas that I wanted to do. And that led to several promotions, and it then enabled me to kind of get very heavily engaged in research and research leadership, which is kind of where I am now. Next slide, please. So what do I think are the key benefits of career in research? I think the first thing is you get to do the research that interests you. So you get to set the direction of travel. You get to kind of think about what are research questions that are important to you, and how can you kind of use that to improve the health of the public. And it also kind of plays into that kind of freedom to let your inquisitiveness, to pursue the angles that you want to focus on, using the methods that are interesting to you. And really, it's about improving the health of the public. It's about thinking about how your research, your evidence can be fed into policy and practice to kind of help people. And then finally, I think the key benefit is public health research is full of fantastic people. There are lots of people who work really hard and have lots of really interesting ideas. And I think often it's the people that make the job so enjoyable. And you find that there are lots of really inquisitive people that ask really interesting questions. Next slide. So in terms of my career highlights, I would say that these two infographics kind of capture the two things that where I think I've had the most impact. So I was very fortunate to be asked to lead the update of the physical activity guidelines for children and young people in 2019. So that's the bit on the left, that those are the recommendations that were developed for the 4 chief medical officers in the UK. And then as part of that work, I was then able to join the World Health Organization's group that developed the physical activity guidelines for across the whole world. So I think you can say that the kind of WHO guidelines have had an impact on the physical activity of billions of people across the world. So I think this is a chance to say how my research, which was heavily influenced by the work I did in my NIHR fellowship, enabled me to kind of have an impact on national policy and hopefully improve the life of lots of people across the world. Next slide, please. So in terms of my future plans, so there's kind of two broad strands. One is I want to lead innovative public health research. My work is generally around physical activity and broader aspects of public health, but I'm always trying to push methodological boundaries. So I'm always trying to think about how I can learn from areas that I don't know about to kind of really develop the way in which my research works. So for example, in one of the recent projects, we've spent a long time doing a lot of ethnographic work. That was really new to me, but it really enabled us to understand things that I think we've been missing from our traditional school-based research. We've also done lots of work in terms of developing new trial designs and thinking about how we can translate our evidence into practice. So I think it's really important, and this is something that was said earlier, to not kind of stand still, but think about how you can push the field forward. The other bit that I spend a lot of time on is building capacity in the field. So it's thinking about how I can create opportunities for others, particularly linking up with practice and cross-disciplinary learning. How can we work to kind of mentor colleagues to enable them to lead their own projects? So I think that's something that's really important and something I spend a lot of time on. Next slide. So what are my recommendations for engaging in research? So I've got seven points on here that I think are kind of the key things that are most important to me. The one is find an area that interests you. So public health is a very wide area. There's lots of subdomains and elements. Find the bit that interests you. And I generally feel quite strongly that if you're interested in something, you'll do a much better job of it. Second of all, I think take risks. So I've taken a lot of risk in my career, and sometimes they've paid off. I can also put up a slide of all of failures in my career. There's an awful lot of those as well, but I think you learn a lot from taking risks. Also work with different people. Don't surround yourself with people that just think and work like you. Think about people that bring different kind of skills to the table. In terms of don't cut corners, I'm a big fan of doing things the right way. So taking time to develop rigorous protocols, developing rigorous methods, because if something goes wrong, you can go back and find the mistake that you've made. It's okay to make mistakes, but actually, if you have kind of adopted everything in a kind of very open approach and shown everybody what you're doing, you can learn much more. I think mentorship is critical. So I was very fortunate to have a very strong mentor, Tom, in Texas, who really has provided an awful lot of support to my career and is normally the first person I contact whenever I have a question. Should I do this thing or that thing, even though he's been retired for several years? And so kind of finding people that you trust that can invest in you. But that does suggest that you actually have to give something back. And I think one of the things that you have to think quite hard about is not just what you're taking from the research ecosystem, but what are you giving back? How are you supporting other members of your community? How are you supporting people around you? How are you sharing findings back with the communities in which you're doing research? That's really important to make sure that you kind of give as much as you take. And then my final point on this slide is really to just remember that as you adopt a career in research, work-life balance is key. So there are only so many hours in the day. You just need to make sure that you fit in plenty of time for all the other aspects of life that are important for you, because that enables you to be the best researcher that you can be. I think that's all I had to say. So next slide, please. I'll hand over to Jote.
Thanks, Russ, and thanks so much everyone for the opportunity to speak here today. So I'm also just going to briefly share my journey into research and what it's given me, and also why I think it's one of the most meaningful careers you can pursue. I'll try not to repeat too many of the fantastic messages before, and I'll make sure that we've got enough time for the Q&A. Next slide, please. So just to really kick off with, why does this work matter to me? Why does research matter to me? So very early on in my career, I was a medical student in London. I'm not from London originally, so I had a bit of a trial by fire when I realised how expensive life was. And I was then in search of jobs at that point, and I embarked on a remarkable new voluntary role as a special constable in the Met Police. Everybody does say to me, was it out of altruism? But it wasn't due to altruism. It's because I had a free Oyster card, which I thought was just wonderful if you're a police officer in London. But you realise very quickly that being a police officer for an Oyster card is not worth it. But it's a fantastically interesting role otherwise. So this was sort of just in my first year of medical school. I remember at that point in my policing role that I had the opportunity to attend incidents involving sort of really quite critical experiences of violence and also abuse and trauma. And I think what struck me from the whole experience wasn't just what was happening in the moment, it's effectively what happened after and also what was happening before. So a lot of those individuals that I encountered, both offenders and victims, would come into contact with police, healthcare, social services, but it was really clear that actually a lot of these services are quite disconnected and no one really had the full picture of what was being seen. And actually there, I mean, I saw it firsthand as well, that there were repeated missed opportunities to identify risk earlier and also intervene. So this experience just is something that really stayed with me. And it made me realize that if we want to improve outcomes, we can't just focus on individual interactions with patients. We've got to ultimately design systems that work around people. And that's what ultimately led me into public health as a clinical career and also into research. Next slide, please. So very briefly in my career, so I studied medicine, started my foundation years in the West Midlands when I truly ran out of money in London, so I had to move back in with my family. And I took a bold move at that point, and in month one of my foundation years, I started a PhD. As somebody told me, it might be useful if you want to do public health in the future. The NIHR played a really central role in my journey at every point. So I transitioned from an academic foundation doctor to academic clinical fellow, academic clinical lecturer, and where the NIHR supported me through training and progression at every point. And then ultimately I was appointed as an associate professor and a professor later on in my career. So over time, I've been very fortunate to build programs of work at scale across the NHS, academia and policy. But the focus has always been the same thing for me, which is how do we improve outcomes for people who are not often well served by current systems. Next slide, please. So what has research given me? Well, I think research has been really transformative for me, both personally and professionally. Personally, it gives you the ability to ask important questions and to keep learning. I mean, I think Rush said it as well, but one of the things that I really enjoy is that you get the opportunity to work with people from different disciplines, often bringing together different perspectives that would not normally sit together. So, I mean, in my circumstance, my 3 PhD supervisors came from nursing, data science, and economics. And all just together to think about how do we tackle this complex problem around violence and vulnerability. Professionally doing research also gives you independence and the opportunity to lead work that can shape policy and practice. But for me, the most important thing is it gives that sense of purpose and knowing that your work has the potential to improve outcomes at population level. And I like what I think maybe it was Claire, okay, I said it earlier, but I really liked that idea that actually that is one of the most exciting things of research in this space. And next slide. So one of the most rewarding aspects of research is when you really start to see it translate into impact. So for example, work that we've done has contributed to changing how violence is understood at a global level and has had the opportunity to influence policy and national programs. So for example, our team does a lot of immense work, and this is not just me, but just, we've got a fantastic team who does an immense amount of work understanding what the health outcomes are of violence. And now this features as a key step in the women's health strategy, ultimately to improve the health and well-being of survivors. We've done lots of other work, so for example, embedding research directly into healthcare systems. So can we use data to support real-world decision making? So with support from the NIHR, with grant funding, we have the opportunity to develop data science tools, which are now implemented in hospitals directly to ultimately maximize patient safety, but also improve population health outcomes. And for me, this is where sort of research starts to become really powerful. So when it moves from publications to start thinking about how care is delivered. So I've been very fortunate to be invited as an expert advisor for a couple of different government initiatives. So I've been invited to support with the development of the National Youth Strategy and also recently at the moment the National Maternity and Neonatal Investigation. And this is as a result of the fact that when you sort of go down this research line, you do get the opportunity to develop specific expertise in areas that are useful for a lot of different government initiatives. And there's been some really key milestones along the way, so including some large national programs, but also that you're very, very fortunate to have the opportunity to hold an NIHR research professorship. And actually, I think that there's just a lot of it is just extremely fortunate for a lot of the experience that I've had the opportunity to experience. But one of the most important things, as I mentioned, is not just about the funding or the grants or the titles, but it's about whether or not work actually improves care and outcomes. And looking forward, so what's my focus going forward? So it's really about prevention and system redesign. So how do we build systems that identify risk earlier? How do we move from reacting to problems to preventing them? How do we make sure that services are designed around people who use them? And alongside that, a major priority for me, as also really outlined very much by the NIHR Research Professorship, is actually how do we support the next generation of researchers? Next slide, please. And so the reason I've stayed in research is really quite simple. It gives you the ability, well, one, I love my job. I actually really enjoy what I do, and I'm very grateful for this opportunity. I love working as a public health consultant, and also as a public health professor. I do really love these roles. Two, it gives you the ability to change systems and not just operate within them. It allows you to work at a scale that goes far beyond individual encounters. And importantly, the impact lasts beyond you. So if you can have the opportunity to engage in policy or through services, it's a wonderful experience in that sense. So if you're thinking about getting involved in research, a couple of additional points that I would just say is focus on problems that generally matter to you, because ultimately that will sustain you over time. It's an interesting one because there are some like really quite critical, high important areas, but I think it's something which is important to find something that matters to you. So for me personally, violence is something that's really important because I had that experience with working in the police. Secondly, don't wait until you feel ready. I think this has been mentioned before because most people never feel ready, and that's quite normal. Third, I mean, this is a really tough one because, to be honest, just being completely candid as well, the best bit of advice is actually just to continue to reach out to people. But I know that it is very difficult to get responses back from people because it is quite hard on both ends of that. But it doesn't mean that you should stop trying, because sometimes opportunities can only come from simply asking and starting conversations. Fourth, I mean, just based on my experience, it's quite good to work with different people across different disciplines, because that's where the most interesting ideas emerge. And then probably the final thing I'd just probably say is to be uncomfortable with the level of uncertainty, because I think research really involves getting things wrong, learning and trying again, and that's part of the process of dealing with that degree of uncertainty. But that's also where you can get some of your greatest joy by going on that journey. So that's something which can be extremely enjoyable too. So just a very final thought for me. I mean, I've said it a couple of times just throughout the presentation. I think the biggest thing for researchers is not about the publications or the funding. I think you genuinely do, very much supported by the NIHR, have the ability to contribute to changing systems that were ultimately, in my opinion, sometimes never designed for people who need them the most. So that's why I think this is a really meaningful career path if this is something that you're interested in doing. Thank you. I think I'll hand back over to GJ.
Okay, thank you very much, Jude. And I'm going to ask all of our panelists to turn on their cameras. So we're now going to start taking some questions from the chat. And this is going to be, I think, a really exciting opportunity for you to ask the questions that are on your mind. So as was shared at the front end, we're going to start with the questions that have been upvoted the most. And so the first one is, I'm a master's graduate in psychology and I have worked in health research during my studies. I want to get onto a research assistant role since graduating, but have struggled because I've been told I don't have enough experience. How do I navigate this? Okay, I'll share 2 thoughts from my own experience as a postgraduate educator and supervisor. And then I'm going to ask Kat and Russ if they have views, seeing as they're from either end of our experience spectrum on this particular question as well. So from my point, I think the first point of advice I would give is one way that you can show that you're up to the task in a sense is by publishing your master's dissertation as well, if you've been able to do that. Partly because showing that you can follow the publication process through and that what you've done is a meaningful contribution to the evidence base is a good way to really show that you followed through and to help you kind of stand out from the pack. That's something that I often look for when I look for research assistant applications. The other point that I would share to you is that really, just keep applying, that the right role tends to come along, but it's often when you least expect it. So those are 2 points I would share. Kat, I wonder if you have any early thoughts to share from your own transition into health research.
I'd say I experienced similar, and it's quite frustrating because obviously you're qualified, but you don't have the experience to get that foot in the door. And for me, I sort of did a sidestep and got involved in research projects and research grants by managing them, by being sort of an administrator, which I know is a little bit frustrating because it's not the skills that you want to be using. But sometimes the knowledge that you build up from just being involved in research then gives you the sort of advantage of, pushing that forward and just being more aware and building that network and collaborations up to make the next step if you're struggling to get into the research assistant role, which is what I did.
Thanks, Kat. And Russ, I'm hoping you can share some experience as someone who employs a fair few research assistants in your work.
Yeah, I think one of the key things is if you don't have direct research assistant experience, do you have other experience that's relevant? So, is there some other role where you've developed skills that are useful? So, sometimes people might come in via a sideways route. Is there a volunteering role in the local community that's in an area that's related to the research area that you're interested in? Can you develop some kind of life skills that would enable you to kind of stand out as part of getting your foot in the door? It's very hard, but often it's about developing skills and showing where they may come from, your entire person, not just necessarily your research career. So it's the broader bit that I would be looking at.
Thanks very much. Okay, so our next question I'm going to ask Jote in particular for his views on this because he's one of the best networkers I know. I have an MPH from the University of London. I currently work as a research analyst in Singapore. How do I network and apply for health research projects in the UK? I have tried to network, but no progress there. So, Jote, do you have any thoughts you want to share on that one?
Yeah, no, thanks, GJ. It's a really interesting one because I guess it'd be interesting also to know if there's a bit more details about what kind of networking you've done. But I mean, just to give a bit of an idea of the sort of thing that I've done in the past. So if we can shift away from general networking to more targeted outreach. So if there's, for example, 5 to 10 like very specific researchers or groups who you want to engage with, want to speak with, and focus on their exact work, if you can contact with them with a very clear and relevant ask, sometimes that can help. So going for quality over quantity in that context. Sometimes also about targeting the right entry points as well. So I mean, with the experience that you've kind of outlined in there, so just even building on the question from before, so rather than networking, potentially there's an opportunity to consider about what kind of roles are we applying for, so the research associate role, research assistant roles, but maybe analyst roles in some NIHR funded projects. In particular, I mean, if I was thinking about this at that point in my career again, I think rather than if you're struggling with general networking with lots of researchers, sometimes approaching NIHR infrastructure as a point of context actually might be a better route in as well. So, for example, some universities have got applied research collaboration, some universities have got biomedical research collaboration, some universities are part of the School for Public Health Research. So actually potentially contacting the infrastructure rather than contacting the research groups can also be a really good option as well. The other thing that I would also probably just say as well, which I personally find quite helpful if people are contacting me sort of as like a cold email, is it built onto the point before. Sometimes it's really useful as well in the way that you do network to also just give a bit of an indication as to what sort of experience and skills you have, not in terms of broader generic skills, but in particular, if you have got any publications, to highlight them quite clearly, quite early on, because it'd be quite useful, particularly for people to know, okay, this person has got this kind of experience in this space, rather than you don't want to start a networking experience where we almost have to, if I receive that email, have to kind of work backwards and think, okay, what does this person do? What are they actually good at? Sometimes it's really helpful if you just say, okay, hi, this is me. This is my publication. I have an interest in this area. I know that you do too. Is there anything that we might be able to do together? Sometimes that's a bit more helpful. But sorry, GJ, back to you.
No, thanks very much, Jote. Okay, so I'm going to take the next two questions together, and I'm going to ask Claire in particular to speak on these because of her mixed practice research experience. And those are, what research opportunities are available for a recent Masters in Public Health graduate in the UK? And also, I'm an international student currently doing MSc in Public Health. What are the opportunities to begin a public health research career? So Claire, do you want to speak, do you want to offer some thoughts on that as well?
Sure. So sort of in the subtext of those questions, I'm guessing, is the challenge that public health careers are somewhat disparate in nature. You've got those that are very explicitly named public health jobs, which tend to be in local authority contexts, often at sort of integrated care board level within the NHS, often kind of population, kind of health focused roles. You've also got those that would work in sort of adjunct organisations and departments of those organisations. So potentially, as Joe sort of indicated, the likes of community safety, oftentimes planning, even colleagues in those kind of areas are often public health trained, but they don't have public health within their job title. So I think my sort of general sort of kind of in terms of how to navigate this would be thinking about, do you have a particular area of interest that you're interested in working in? Or do you have particular kind of experiences that you want to have and start from there? Similar to the research world, I would say reach out to organizations and ask the question. That is often the easiest way of getting a reply. I say that as the foundation part, as somebody who has kind of started their kind of career in practice. Tagging on the research element end there will sort of give you a slightly different view. So if you've got that sort of practice focus as a starter for 10, bringing in that research role. So the Academy Awards that I have gone for have been those that are offered to people working in kind of substantive practice-based roles. There are opportunities to come into kind of jobs such as was mentioned by Nicola earlier. So those kind of local authority research officer positions, which give you that sort of implementation kind of translation role. There are public health kind of research roles within academic universities that are embedded research within local authorities. It's a really disparate kind of a place to be navigating. So my sympathies to you. That's a few kind of suggestions. I don't have sort of the silver bullet, I'm afraid, but I think thinking about what you're interested in to really refine that down and what the experiences that you want are will be a way of helping to kind of refine that process. Not really sure I answered the question there, GJ, but some thoughts.
That's great. Thanks, Claire. And so the next question with upvotes, I think, is asking a similar one around getting into research roles. So I think what I would say to this person, particularly if you have a dental public health background, we know that dental public health backgrounds are really valued and are an important growth point as well. So thinking around how you blend those 2 points of expertise together, and I think, again, taking on a lot of the advice that was offered by our panelists just now as well. Okay, our next question is, as an international student aiming for a research career in the UK, what practical steps should I take in the next 6 to 12 months to become a competitive candidate for NIHR opportunities? So again, I'm going to ask Kat and Claire to speak to that because I know that's a little bit closer to where you are in your careers. So Kat, is there any advice that you would give to someone who's hoping to become a competitive candidate for pre-doctoral opportunities?
Yeah, I'd say so to identify if there's any sort of voluntary or community experience that you can get, and also be clear on the areas that you are interested in. So I'm very much about communities and food, and I generated those ideas from volunteering at a food bank. So I'd say just be clear on sort of what you'd like to be involved with and aim for some experience to get involved in any way you can.
Okay, thank you. Claire, anything you want to add to that?
Only just to think around some of those transferable and sort of soft skills. So as Kat sort of alluded to, that sort of networking aspect. Think about examples of where you've led something. Think about examples of where you have done problem solving. So think about not necessarily what a research output through like a narrow lens might look like, but think about those transferable skills that you would need to begin researching, which is independent working, taking the initiative, leading, networking, problem solving. Think about where you can exemplify kind of where you've done that within either your study, voluntary kind of roles or work placements, and really draw from those.
The other thing I would add to Kat and Claire's, I think, really useful insights is that if you're hoping to become competitive for NIHR opportunities at either pre-doctoral or doctoral levels, That does require, I think, a real focusing of your interests. It doesn't require you to know what's going to happen to the entirety of your research career, because as Russ and Jode said, that really grows and develops over time. But one of the best things that you can do is to develop a clear focus around where it is that you want to take your research career. What are the kinds of methodological approaches or substantive areas you really want to stake your claim to? And in conclusion, what is the sort of training that you need to get you to the place where you can really begin to develop that independent research career? So one of the things I would add, just to cut across those 2 points, that in addition to the transferable skills, in addition to the soft skills, in addition to the publications, thinking with a little bit more focus about where you want to go is going to be important to convince a panel that you have a direction of travel and that you therefore should be funded to pursue and develop your research career. Okay, next question. Let's see, question for Jyote. How would you have navigated moving into public health and research from your medical background if you didn't have the opportunity to start a PhD when you were in foundation years?
Yeah, it's a good question. I think it's really important to say that an early PhD is absolutely not the only route into public health research, and actually is just generally probably not the route that most people take. I think if I didn't have that opportunity, I think my focus would have just been actually just getting on into public health specialty training as early as possible. And that pathway itself is just a really strong route into research itself. So if anybody here is medically trained on the call, maybe in your foundation years or working in a different route, the public health specialty program involves your first year being an MPH, and then there's often an opportunity potentially for a 1-year university placement within training. So as in a GMC registered placement being at a university, just to give you methodological grounding and exposure to academic environments. But alongside that, if time allows, and I'm conscious that may not be the case for everybody and it's not a requirement, but you could also look at smaller ways of getting involved in research by linking it with local academic teams in your hospital, in your clinical setting, contributing to projects. If you're very early on, like I said, a medical student at this point, maybe using opportunities like the specialized foundation program post in public health to build some of that experience. Just to give you also the second bite at the cherry to apply for an academic clinical fellowship, because I am very conscious that public health specialty training at the moment is extraordinarily competitive. So if you are able to do anything prior to applying that allows you to also open up the possibility of going for an ACF post, that could also be a second way actually also to give a go with that.
Okay, thank you very much. So another question that we have here is, I am interested in pre-doctoral or aspiring to do PhD. I've just completed my master's in public health. While I wait for a suitable field of research, how can I dip my toe into research as I'm very interested? So I think, again, a lot of the same kinds of things that we've described. What are the opportunities to develop some of those soft skills, some of those transferable skills? What are the opportunities to really capitalize on the work you did during your MPH? And do you have the chance to bring a little bit more focus to your aspirations and your interests and your training needs in order to help you get to that next place as well? So I think all the speakers would agree with me that that's really the next place to go as well. Okay. Let's see, another question. Do you have any suggestions for me on how I can start my career in research? Yes, I've tried to get a funded PhD, but failed to manage one. I've published papers as well. That's a bit tricky. I think what I would say there, and I will also ask colleagues as well if they have a view on this, is that, with PhD funding, I think you kind of take the first funding that you can get, in my experience as well. Number one, and number two, that where you necessarily start out doing your PhD is not where you're going to end up. So I think it can benefit you to think a little bit more broadly about what your interests are in the first instance, on the basis that a PhD is really an opportunity for research training and for getting greater depth as well. My own research really substantively focuses at the moment on child and adolescent health, as well as on gender-based violence. My PhD was on drug use and extreme sexual risk behavior. So a real evolution on the path as well. I know that's been the case for other colleagues as well, but really I think what I would say is look carefully, and if you're also trying to develop a funded PhD, you can also apply to NIHR to undertake a doctoral award as well. I'm just going to ask Nicola if she can talk a little bit around the support that the Specialist Center offers for people who are hoping to apply for doctoral awards from NIHR in public health research.
Thanks, GJ. So, apologies, moved my microphone out of the way. It's really just to flag up that we have a team of methodologists based across our based across our national centre that can help you develop an application, and the earlier that you can get in touch with them, the better. So I've shared a number of links with people through the chat to give you the detail of these different awards, the eligibility criteria, what is funded, etc. If you're looking at developing an application after reading all of that, then I'd suggest you get in touch with the specialist centre, and the process is that we then triage you to one of our methodologists that we feel is best suited to you once you've filled in that early application kind of contact form and given us a little bit of an idea as to what award you're going for and what your background is. That person will then set up a conversation with you to get an understanding of what it is you're hoping to achieve and how they can help you, and then begin to kind of refine the support that you may need. So first of all, that will be assessing if that's the right award for you, and if there's other support that can go in around that. It could be working up your application form. So that's actually, pulling in the information that's needed. And we say it takes a minimum of 3 months to develop one of these applications. So please do bear that in mind. Then it's going through those different points of process, getting through to shortlisting. We can support with mock interviews. We can put you in touch with previous award winners, people who've gone through this process before, so they can offer you a little bit of mentoring and support, and really just trying to round off your application so it's as strong as it can possibly be. So again, bear those long lead-in times in mind. The earlier you can get in touch with us, the better that is for yourself and for the methodologist who'd be supporting you.
I'm just going to ask Claire if she wants to follow up on that in terms of when you thought specialist center support was most helpful for you in your own doctoral journey.
Yeah, so for me, mock interview was really, really important. Sense check on aspects of my application, particularly thinking around where I might recruit kind of diverse public and patient involvement and engagement from. So a sense check on sort of those specific aspects. And mock interview was really, really helpful in terms of a group of people who were not familiar with me or my application, how well I could actually convey that when on the spot.
Thanks very much, Claire. Okay, another question for Russ. I'm not picking on you, Russ. This question is specifically for you. Ooh, I lost it. When you say take risks, what sort of risks do you mean? Is it possible to provide an example of a risk you took that paid off and one that didn't? What did you learn from this?
Well, the biggest risk I took was I took a job in America, having never been there. That was quite a risky move, and it did pay off well. But I think in terms of taking risks, I think you don't know when you start a conversation with somebody where it's going to end up, and you don't know if you start looking at a particular PhD or research option that is going to be exactly what you want it to be. So I think I would encourage people to do things that might feel outside of your comfort zone. So I think, if you challenge yourself in terms of the type of research you might do, perhaps looking at different research methods, trying to bring in research methods that aren't normally used in the area that you traditionally work in. So, NIHR has a big focus on interdisciplinary research. Where can you bring in learning from planning or geography or climate science into public health? Those kind of risks that look a little bit different to applications that are normally coming actually bring in extra value. So I think thinking slightly differently to what's been said in the past. And just as a follow-up to something that's said earlier, I think one of the things that's really hard for people thinking about research is thinking about what a PhD looks like. And I think one of the best things you can do is spend time on Find a PhD and reading the outlines of what people are advertising in terms of PhD. So you get a sense of what they look like and the types of study designs and range of different methods. And also there are lots of posts that get advertised on there. And if you just look at what's included in those, that could be a really useful way of kind of identifying the types of research that's out there and different options.
Russ, thanks very much. And that's all the time that we have. So just a real round of applause and appreciation for our excellent panelists. Thank you, Jote, Claire, Nicola, Russ, and Kat for sharing your experience. And thanks to all of you as well. So we'll make the slides available afterwards. We encourage you to contact the Specialist Center for Public Health if they can support you in your goals. And of course, the NIHR Academy is always open to answer your questions as well around developing your career in public health research. So thanks to all of you very much. Hope you have a good rest of the day. You're welcome to stay in touch with us, and we thank you for joining us for this webinar.